Hi everyone, so my name is Sarah Gilgunn and I come from the School of Biotechnology in Dublin City University, and the title of my talk today is Getting to the Bottom of Prostate Cancer Diagnostics. So prostate cancer is the most commonly diagnosed cancer in men worldwide, with 1 in 7 men being diagnosed with prostate cancer in their lifetime. The prostate is a small walnut-sized structure located underneath the bladder near the rectal wall. And prostate cancer happens when cells in the prostate change into a tumour cell, causing the prostate to enlarge. Now, most forms of prostate cancer have little effect on a patient's life, however some can be fatal. Measurement of a protein that is made in the prostate, called PSA, is the gold standard for prostate cancer diagnostics. And if you present with an elevated level of PSA, you're sent off for the dreaded rectal exam. However, the PSA test isn't cancer specific, and it only indicates that there's a problem with the prostate. So this leads to a lot of overdiagnosis and pain and discomfort for patients because of unnecessary biopsies and invasive procedures. There is currently no biomarker available that will allow a doctor to determine between a potentially fatal form of prostate cancer and a clinically insignificant form of prostate cancer. So how are we going to overcome this problem? Well, the answer is antibodies. Our immune system is amazing. It's our own personal protective army, and antibodies are the soldiers that lead this army in recognition of foreign invaders. And scientists like me can use this natural technology to engineer antibodies which can be used in a variety of diagnostic tests to recognize different proteins in a patient's blood sample. So PSA, the current marker, circulates in the blood as many different forms. And it's thought that looking at these different forms will determine between aggressive and non-aggressive forms of prostate cancer. So my research involves making these antibodies to specifically recognize different forms of PSA. I've tailored an army that can specifically identify between indolent, non-significant forms of prostate cancer and the really horrible aggressive forms of prostate cancer, with the ultimate goal of reducing overdiagnosis of non-fatal forms of prostate cancer. So, it's very obvious that there's a new biomarker needed for prostate cancer detection, and I hope that my research will help solve this problem. I'm going to employ my army of antibodies, along with some other cancer-specific markers, to a brand new diagnostic test. It's going to be a very simple piece of plastic that I'm going to lay my antibodies down on so that they can recognise the different forms of PSA in a patient's blood sample. When a man presents with an elevated level of PSA in his blood, he's faced with a very difficult decision of what to do next, and I hope to help with this decision making. I want to improve prostate cancer diagnostics by reducing the number of biopsies and invasive procedures that cause pain and discomfort for patients, and that will help a doctor to develop the best treatment plan for a patient's individual prostatic disorder. So while I might not be able to grow a moustache for November to raise well money for prostate cancer awareness, I do hope that my research will help change the lives of men worldwide. Thank you very much.